Okay.
Good afternoon, everyone. It is 12:53, and I would like to call the meeting to order. Rakisha, do you mind doing the roll?
Not a problem. Dr. Baravecchio? Mr. Bennett?
Present.
Mr. Billings? Ms. Crane?
Here.
Ms. Julie Foster Hagan?
Here.
Ms. Jill Hayno?
Here.
Ms. Angela Harmon? Ms. Kelly Aduli?
Here.
Ms. Nguyen? Mr. Rocca?
Here.
And Ms. Stewart?
Present.
We have 7. You have a quorum.
Okay, before we get started, I just want to remind you all of a few rules for committee members and members of the public attending in person. Please raise your hand to speak and wait to be recognized by the chair before speaking. To help the meeting run smoothly, please keep side conversations to a minimum and comments related to the topic we are discussing. For those committee members who are attending virtually, remember you must be on camera and have your first and last name showing to be counted towards our quorum. Please keep microphones muted unless called upon by the chair. Electronically raise your hand to request to speak and wait to be called on by the chair. For attendees, electronically raise your hand to request to speak. Once recognized by the chair, your microphone will be turned on. After speaking, the microphone will be returned to mute. Also, the Q&A is only to be used by those needing an ADA accommodation to participate in the meeting. Public comment will not be accepted via the Q&A except for those individuals who requested the accommodation. As for order, committee members in person and virtually will be allowed to speak first. Public members in person will then be called on, followed by public participating virtually who have had their hands raised. Comments in the Q&A will be addressed last. As with all hybrid meetings, it can be difficult to keep track of all those wanting to speak in person and virtually, so please be patient. All comments and questions from public may be limited to 2 minutes at the chair's discretion, so please keep that in mind. Depending on time constraints, we may also limit comments to once per issue. Also, comments about a person's character will not be allowed. Finally, members of the public will have the opportunity to provide public comment before each vote and during designated public comment periods. The chair may also use their discretion to determine if comments will be accepted outside of those times. Okay, so everyone should have reviewed the October meeting summary, which was attached in the agenda you received in the email. There's a copy in your committee packet. I need a motion to adopt the October meeting summary. So Tori Roca motions to adopt the October meeting summary. Is there a second?
Oh, okay.
Is there any discussion? Any public comment? Okay, we will now do a roll call vote. Rakisha, can you please call the roll?
Dr. Baravecchio? Mr. Bennett?
Yes.
Mr. Billings? Ms. Crane?
Yes.
Ms. Hagan?
Yes.
Ms. Hayno?
Yes.
Ms. Harmon? Ms. Kelly Aduli?
Yes.
Ms. Nguyen? And Mr. Rocca?
Yes.
Thank you. The motion to accept the October meeting summary has passed by a vote of 6-0. So moving on, first on the agenda is an opportunity for us to consider activities to recommend to the council to be included in our fiscal year 26 action plan, which will begin on October 1st, 2025. In your packet is a printout of this year's action plan, which lists our current goals, objectives, and activities. Keep in mind, we are responsible for goals 1 and 2 of this plan, and all of the activities that this committee may recommend should align with the council's current goals and objectives in the plan. Also, what we come up with today is simply a recommendation. Should the council agree with our recommendations, the Planning Ad Hoc Committee members will determine what items will be brought forth to the council for vote at a subsequent meeting. I think our best option is to come up with ideas that we can collectively agree on as a committee and make one motion with all of our ideas. Would anyone like to start sharing their ideas?
I do.
Okay,
If you would like.
yes.
And that is Mr. Tony Piontek.
Sorry, I would like to recognize Tony Piontek for public comment, or sorry, for his comment.
Tony, you had your hand raised. Did you have something you wanted to say?
Tony, can you hear us?
Oh, no, I mean, there's still one. I'll try one more time, Tony. I'm allowing you to talk.
Tony?
Can you hear me now?
Yes.
Yes,
Okay, thank goodness. This idea of being on this committee, are we able or are we capable to do more than what we're just doing now for this committee? To spread this news to other nonprofit organizations rather than just us on this topic?
so right now, Tony, what we're doing is thinking of ideas for next year's action plan. So you currently have an action plan with the council that says this is what your council is working on this year up until September 30th. And so right now, what we're talking about is what would you like to see us do starting next October? What kind of things you would like to see the council work on for the next fiscal year? And so certainly if there are any organizations out there that would also like to chime in, we do have public comment. They can provide their recommendations, committee members can provide their recommendations. But right now, we don't have anything to share or to push out to other organizations.
Wow.
That's what you're asking.
I do know this has been a very pivotal piece for us where we are in Region 4 with our two representatives, Blake and Bo. And what just happened?
I just started sharing my screen.
Oh, okay. So transportation has been a big pivotal part of our area. I've diligently have talked about it many times to both of them, and we really hope we can find out the necessary steps and the process of getting public transportation where I live. We're just a parish. We're not like a big UL university because they have public transportation. They have buses and stuff already in plan using. And I'm just going to keep on fighting for it because we really need it over here. And the last time I talked to both of them was when both of them were going through their um through their steps of being as a representative for my area, for our area. So that's what I'm really hoping to push a little more, make it a real first impression of how transportation is for us over here.
Okay, thanks, Tony. We do have also, for just committee members to know, your next step after looking at your action plan for next year is gonna be the 5-year plan. And one of the areas of emphasis in that 5-year plan is transportation. If we're being honest, I don't know that you'll be able to put something in your action plan next year that's gonna solve the transportation problems, because we've been looking at that for years and we still don't have a solution.
I
But
know.
it wasn't on our 5-year plan, at this current 5-year plan. So there hasn't been a lot of work that was done on transportation issues. But if that's something the committee is interested in looking at in the 5-year plan, that could be an area of emphasis that you want to look at, and then we could potentially look at what we could do over the next 5 years to address some of those transportation issues. Yeah, but
Okay, so there's another thing that I've been thinking about that we may want to add. As we all know, recently we lost Lauren Womack to a car crash. And I started looking into what driving is like for wheelchair bound people, and they tend to die in car crashes a lot more because it's not as safe for them as it would be for an able-bodied person. So could we maybe work on some sort of legislation or like some sort of law that might help to increase any safety measures or type of like restraints or safety mechanisms that could help in situations like a car crash?
I know that, Rakisha, you're taking notes for that. We can definitely put that down. Yes.
Would it, cause now I'm kind of getting myself confused and I don't know what all being on the safe plan entails. But for the state plan, would that be legislation or would that be maybe to offer like training, like training?
Or transportation.
Yeah, like, or whatever, like, because that's a really good idea. I'm sorry.
So if you look at, you have, as far as legislative options, I don't know, you'd have to look into that to see what is possible, but you could certainly, if you're looking for, like something you want to do in next year's action plan, let's say, you could, if it makes it through the planning committee and all that, you could look at doing some sort of proposal about different, trainings that you might be able to do about safety measures. But we'd have to do some research on, so like, what would you be training about? Are you trying to train individuals? Are you trying to train the people that are manufacturing the vehicles or that are doing the adaptations? Like, there's a lot that goes into it. So you just have to see what's possible to get done next year, what would have to be a continuing process. But if it's legislative, then you would want that on your legislative agenda as well.
Cause last time I made a recommendation for a training, the training did not go over well and only less than 1 year.
Yeah. And in this situation, you would probably have to make sure that you actually have someone that can train on these particular issues. That's the purpose of sending out a proposal, to make sure someone is equipped to do some sort of training like this. That could help individuals or families or whoever the provider might be that are doing these adaptations. But Stephanie might be able to chime in on the proposal.
I just wanted to, kind of echo what you mentioned though. If we're looking at specifically for activities for this coming action plan, doing as much as y'all are wanting to with that and like the outreach for it, the action plan might not be the best option, but the 5-year plan concepts might, because those are bigger and then we'd have more time to accomplish them. So cause I think that they're great ideas. I just wanted to be realistic because we still are gonna have to do the research, figure out exactly what it is that you're looking for, and then find somebody that can actually do a training. Whereas if it were a big concept, we would have time to maybe have some kind of, and this is just off the top of my head, y'all, coming up with like a, I'm trying to think of the word that I'm thinking of, like a program to get the information out, maybe in the first year, and then like getting all the research, yeah, and like just kind of building it from the ground up, cause we just don't know what direction to take with it, at least quite yet, and because it's such a big idea, I would say that would probably be more for a concept.
And it would
That's
fall
just my
under
opinion.
that transportation area
Yeah.
emphasis as well.
Yeah,
Which is one of our
Along with
areas of
access,
emphasis.
which is what Tony was talking about.
Mhm.
Okay, Vivian?
I was thinking more along the lines of legislation to legally obligate manufacturers to make safer vehicles for wheelchair-bound citizens. That way, less people die in car crashes. That, like, these complications could have been avoided had there been more protections in the car for wheelchair-bound citizens. And then in addition, maybe think of like some mechanisms or some ways so that if they do get in a car crash, they aren't just stuck. But I think we need to explore legislation and not just trainings around that.
I think that type of legislation, you're probably looking at more of a federal, national type
Standardization.
piece of legislation, because you're asking manufacturers to change how they're making vehicles.
Right.
And they're not gonna do that through a state mechanism. So we'd have to look at more of a national, it's a lot.
How would we go about that?
5-year plan, you put this on your 5-year plan, we would do what we can here, which might involve trainings and things like that. And then getting advocacy around this issue, start having people talk to their senators, their congressmen, and then see if they would be willing to bring some sort of legislation.
Thank you.
I was given some recommendations, ideas, concepts for, some ideas. Some that, Jill and I had just highlighted. One was FMLA style leave for parents of disabilities, FMLA's leave, that type of style for parents of individuals with, disabilities to help sustain employment and prevent job loss or instability. Another one we had was to require Medicaid to cover both standard and electric wheelchairs, not just one or the other. DSW is allowed to stay with patients in the hospital when family cannot be there. Healthcare coverage for DSWs. And then, task force training for abuse and neglect was some that we highlighted. Are there any comments about any of those? Yes. Julie.
So we've been, the one you mentioned about the DSP payment when
Mhm.
they're in the hospital,
Okay.
up until, and Brian may know more about this, but up until about a year ago, or maybe even less than a year ago, CMS had kind of a strict allowance that said you cannot, they can't consider that double billing. They've started to tell us that in some cases, we may be able to do that. So I know we've started exploring kind of to better understand what we can do. So just letting you guys know that is on our radar in OCDD. And I know we've had some conversations with Medicaid about it. What we're trying to figure out is because it's brand new. They didn't just go from you can't pay for it to now you can. It's like, well, you might can, but with certain caveats. And so we're just trying to really understand what that means and look at, because we would have to put it in our waiver application and make it part of our rate. So we're trying to find out, are there other states that are doing this and how are you doing it? How did you get it approved from CMS? So not saying you guys couldn't put that on your agenda, just letting you know that that one is sort of something we've started exploring because we have heard from a lot of families and people receiving services that it's a problem when they can't have the DSP and the assumption that the hospital should then provide that care is that it's not happening, realistically not happening. So, but again, we're trying to study, because last year, if you'd have told me that, I'd have told you CMS doesn't let me. Now I know that there's some way that I can do something. I just don't know what it is yet. Okay. Brian, if I said that wrong.
No, that's right. I think that sprung up as a result after COVID. There were several things that popped up during that time period that I think prompted CMS to look at that again. And but like Julie said, it's not just a blanket approval for everyone to do that. We would have to negotiate that with CMS, and we would have to provide the justification as to why it was needed. What's needed if the hospital wouldn't be performing, and I think it would have to be specific to the person and laid out in their individual plan of care that their need is this, so this is why a worker is needed while they're admitted to a hospital. So. Questions, Brooke?
Oh, are there questions online?
Oh, no, just I had.
Oh,
questions.
sorry.
So 2 questions. One would be, I guess for Julie, Brian, maybe. But I know that the topic of, the workers being allowed to stay with folks at the hospital has come up numerous times. And how often do you have like any sort of updates? Because I don't want to say like, can we get an update every time we have a meeting? But if y'all know every 6 months or something, you get something, maybe we could get updates here at this committee about that particular issue. Just that could be a way that we could be looking into it, I guess, and see if there's something we can do to help. Once y'all get more information about what you can or can't do, we can help maybe get info out there if we need to. The other one was for you, Brooke, more on the lines of the things that you mentioned. Is that your concepts for a 5-year? Or is that stuff you want to try to accomplish next year?
I would
Because
say,
right now y'all want to differentiate between what you're doing next year, what you're going to try to accomplish over a 5-year span starting.
It's 5 years in the next conversation.
okay,
Because some of those sound more like 5-year concepts to me, but I don't,
5-year.
okay.
So I did put up, in your packets on the screen, it has the action plan, this year's action plan. So we're looking for things like these activities, and it's just more to, is there something that we need to add or something, under, what is it, goal 1 and 2? That you feel needs to be added. So we're not really going through each and every one of them, but if you're looking at it and you're reading, community living and supports, looking at these things that are in the goal, did we do that in any of these activities, or is there something lacking that you feel like, oh, you know what, we didn't do anything with inclusive, affordable healthcare. Let's look at something we could do next year, like that. Or even preventative health services, which is the objective for that. No, I don't know, I'm just looking at it.
Can also be something, if we are working on a current activity that you are very passionate about, we can also recommend to continue that activity. I know these activities are just getting started, so we don't have a lot of information on success and that stuff, but in past years, sometimes y'all have been really passionate about certain activities that you want to make sure the planning committee knew, don't cut it. So if you have something like that as well.
Yes, Christie.
What have we done for activity 2.1.2? That's part of the thing.
I can tell you because that is one that I monitor. So this one was rewritten and at the end of last year, so the 2024 plan, we did a bunch of research and what I found was if this wanted to be done, the only way to get it done would be to hire an outside entity. So that would be hiring some kind of like some contractor to put on a training that would be just like any of the other trainings that we host. So they would set it all up. It cannot happen through the schools. LDOE has it in their policies, procedures, but it's not, so they have health, but sex ed is not mandated. So it is very specific to each school district gets to
And the
decide.
parents get to sign if they approve it or not.
And each one gets to decide what curriculum they use, and then that curriculum is approved from LDOE. If I remember correctly, this has been last year from when we had those conversations with Meredith. So when we changed it for this one, it was just, let's see what kind of accessible sex ed can we have? If it can't be done at school, what can we have? So the two things that I do want to point out, and I don't think I have any update on, it might have been on Q4, so at the October meeting, that's not what I'm trying to say. YLF, Youth Leadership Forum, they have a session on dating and relationships. And that is one of your activities that y'all are funding. So we felt that that helps us meet this activity. And then we also have, which I don't know because they haven't done any trainings on it yet, but the one that's the abuse and neglect and exploitation training. I'm not sure if this is something that they would touch on. It wouldn't be for like middle and high school people. But it might go into how to recognize those things. And I don't know, because we're just starting to work on it. So that's just an idea of where we are with this one specifically.
Yes, Joe.
Can one of y'all, like, I don't really know, but like, can y'all kind of go in depth with what we're sending out to do, in the yearly action plan versus what we're trying to send out to do in the 5-year plan? Like, something in my head thinks in roundabout ways. But in one, you can change the activity. In one, you can change anything, and then in the other, you can change activities for non-objectives or something. Am I coming in the familiar bar?
So you're asking if we can change activities, but the objectives need to be the same. That's what you're saying?
I think.
Are you asking like what are the difference between what we can put on the action plan and what can go in the 5-year?
Yeah.
Okay.
Okay, so for the action plan, we are specifically looking for activities. So things like activity 2.1.3. This is something that y'all came up with and voted on and said, we need to have training for people that have co-occurring disorders to navigate the system of both systems, right? So y'all came up with that activity and then, that went and it was voted and it was put in. For the concepts, they are broad ideas of a big thing that you wanna accomplish. So this might only take a year. A concept could take 3 years or 5 years. And I would think of them almost as like as an example, one of the ones from the last 5-year plan was that they wanted to do research on the first responder stuff and then go into a training, and then I think it was like a 3-year, they had like a
Yeah.
timeline, like a 3-year timeline of how they were gonna build up this training.
Okay.
So that would be a bigger concept, even though we had an activity. I know it's confusing.
One, either cause our goals stay the same, so on one, either objectives or activities change and then vice versa, but what,
Okay,
like, I don't know if that was a question, but to the best of, like, what can change when?
okay, so for the action plan, for the activities that you're coming up with, that is just based on the goals and objectives that we have now. So that's not gonna change, just the activities are gonna change, right?
Okay,
For the 5-year plan, when we get to that, which is gonna be sometime probably in the summer, when we really start planning, we're gonna rewrite goals, we're gonna rewrite objectives, so the whole thing is gonna change.
okay, that
Okay.
is exactly what I wanted to know, thank you.
You're welcome.
Yeah, I like to think of the 5-year, when they say concepts, more so like ideas. So we have the idea that transportation system is broken, right? Alright, so that might be a concept but we're not worried about the marching orders just yet.
Okay,
But for the action plan next year, we want the marching orders of some specifics of things that we need to do. Like Stephanie said, according to those goals.
that breaks it down really well, breaking, thank you.
But it sounds like y'all have come up with a lot of concepts.
So we're doing like, that's what we're trying to do today is to come up with concepts, right?
Yes, we have it broken up in the agenda though, because I think it'd be a lot easier if you do one motion where you just focus on activities for next year.
Okay,
And then pick this conversation back up and do the concepts. Or do the concepts now and then do your action plan next. It'll just kind of reverse your agenda a little, but it's just easier to separate them so you don't get confused about what's gonna be a concept, what's gonna be next year. That kind of thing. So that's why we broke it up.
That's gonna nod my head.
But that is your goal today. And if we have time, we'll get to the other things in the agenda, but your goals today are to come up with those concepts. And to come up with ideas for an action plan for next year. Or a recommendation, I should say. 'Cause
Okay,
again, it doesn't mean that we're actually gonna do it, it's just what's gonna go to the planning.
alright,
I do have a question about it's under objective 2.3, activity 2.3.1.
3.3.1.
Yes, what have we done so far with,
I don't have your status.
do we have a quorum and does Bridget have my packet on the premises?
I don't know.
I don't know, we'd have to check on that in a minute.
Okay.
I mean, we do have a quorum, but I don't know about the packet.
Status report.
For 2.3.1, Ebony has been the one that works or has worked on that, so I don't have all the details because she's not in the room.
Mhm.
But we started making progress in conversations with them, trying to see if we could partner and assist them with, looking at the materials that they were making. Can we help maybe print some of the flyers? Can we help with the distribution? And the thing is, whenever, the administration changed, a lot of things were shaken up in that particular department.
Okay.
And so we've kind of been letting them get settled, before we can start engaging again to see what their direction, what direction they want to go in now and see how we can help with the work that they're doing.
We have a status report, ladies and gents. Who wants it?
The status report is printed out and is in your council meeting folders, which we do not have in this packet, but we can get that for you, today. It's probably floating around out there somewhere.
2.
But Stephanie does have the information up on the screen, at least for the activity, and yeah, the status report
And I can make it bigger if it's.
will tell you, what's in there.
No activity is gone.
That is one that I would like to continue.
Is there, talking about the women's health
Mhm.
there, yeah, because that was our,
It's our.
targeted disparity, is that the correct word?
Yeah.
Stephanie? So
It is.
what would really be helpful is if you also had some specifics of things you might want to accomplish through that.
Just some guidance.
Because sometimes when we just say collaborate, it gets a little complicated because we don't have much direction.
Yeah,
Um,
one that I would say I'm personally passionate about is preventative screenings for women, like mammograms, pap
Yeah.
smears, of that nature.
I think.
That's one that I would like to include in the activity, preventative cancer screenings.
So. Would we make an objective to specifically include?
Preventative screenings. Preventative screening.
So I think what you're saying, Brooke, not trying to put words in your mouth, but just for the note takers. You still want to continue 2.3.1,
Correct.
but include maybe more language that says we should focus specifically on maybe preventative screenings,
Mhm.
specific to cancer screening or just
I would
preventative?
just, preventative screenings.
Okay,
But I just know, I would just say,
so just
You know-
kind of clarifying that activity language a little more
mhm.
with looking at preventative. Okay.
And I'm sorry, I'm gonna be a little. Just to clarify even more, are you looking at trainings for individuals to like?
So I'm thinking of like, just the same, like accessible, like inclusive educational materials.
Okay,
Like something that shows like, maybe like how to introduce this topic to your patient, maybe
okay,
provider focused.
Okay.
Provider, I'm thinking
For
provider,
them to present and explain the information in such a way that's more understandable, I guess, to folks,
yeah,
that kind
Like
of
focus
sort
on
of.
the benefits of early screening, what you can prevent.
correct, cause I'm
Again,
thinking of just like when my 6-year-old, I mean, she will be a 40-year-old woman, and I would like my daughter to be screened and have a mammogram. So how would that be addressed with the parents and the provider? And I guess that type of,
I do have a comment
okay,
that I was asked to read, if y'all are good with that. From Tony Pianta. He is wanting to look at a source of getting people trained in experience and with experience in homebound, handicap accessibilities, and trainings and finding someone that can assist in those areas. So that was his comment.
Would that kind of fall into the activity 2.1.1? Let's oversee implementation of community and family support.
Okay.
Can you repeat what the training was for?
Oh, I'm sorry, me, yes. He just says training people who have experience in homebound, handicap accessibilities and finding someone that can assist in those areas. Like training to find someone that can assist them. It could possibly be. Not sure.
Can you repeat that, Stephanie?
I can reread it.
Sure.
So he said to get training. To get training for people to have experience in homebound handicap accessibilities and in finding someone that can assist in those areas.
Tony, are you referring to DSW training?
Would y'all like me to
Or-
allow to talk so maybe he can explain? I'll turn his mic on. Tony, I'm gonna let you explain a little bit more. And there you go, Tony.
Tony? Can you hear us?
Tony?
I have them unmuted. Tony, can you hear us? Tony, if you would like to, just kind of raise your hand if you wanted to explain a little bit more of what you were thinking. I'm gonna go ahead, okay. I see that your hand is raised. I'm assuming you can hear us, but we cannot hear you.
Feedback is good.
Tony, just try to type it into the Q&A and I will read it once you have it all typed.
You guys have any other ideas?
Oh, Sherry, I'm
So ideally, would it be a good starting point to basically look at the objectives, say under goal 1 now, and see if it's something that we feel has been, started off well and want to continue? And then look at them and see, oh, well, we really haven't made much progress in this. Maybe it's not something for us to continue as an action plan. Because I think some people are kind of on the borderline of what is actually 5-year and what is action plan.
Yeah.
Okay.
So I think right now, get 5-year out of your brain.
Yeah.
We're not doing any concepts. We're not looking at 5-year. You're strictly looking at what you want to do next year. And kind of like you were saying, we're either adding, taking away, or as Stephanie mentioned, the goals and objectives in your plan cannot change. Only the activities change. So if you read a goal and you're like, oh, we're doing this, that, and the other, but oh, that last sentence there, we're not doing that. So what kind of activity do I need to do to accomplish that part of our goal? So that's what you're looking at. But just as you could say, hey, let's continue working on women's health, you might also see, oh, you're doing this project and yeah, it's not, it hasn't been going well, or we've done it for a few years. Maybe the recommendation is we don't continue this. You may not have something you're replacing it with in your mind just yet, but you might be freeing up the money from that contract for something that might come up in the education committee, might come up on the floor tomorrow. Or you might think of whenever you're graciously volunteering your time to be on the planning committee and you're thinking about things that you want to do in that committee as well, or hearing other public comment. I will say last year, y'all did a really good job of really going through a lot of the activities and removing things that we had been doing for many years. I mean, we have things that kind of stick around because it really helps us with our advocacy goals, like Partners, LACAN, now Youth Leadership Forum. Because those things, even though it's the same program, it's different folks that are coming in and out of that program every year that we're training. So stuff like that, I would recommend you keep those things around. But we did a lot of sweeping changes last year with a bunch of new activities. And so those of you that were here last year, that's kind of the thought process, right? Of looking at what we can bring you, what we can freshen up instead of just doing the same old, same old. Yeah. But as y'all learned in retreat yesterday, this has to come from you. We can't tell you what to do on your plan.
Like if y'all give us ideas and we say, oh yeah, be like that, that's better. I would have never thought that of that.
I feel like I hear Cheryl from the retreat telling me I can't do that.
And just to remind you, there'll be staff recommendations when the planning committee meets, like we'll have gone through and have some recommendations. But this is really to get y'all's ideas so we can start looking into them and getting them together.
Because our recommendations to you during planning time is the feasibility of doing what you would like to do. Can we actually do that?
So for activity.
And then we might have an alternative for you.
For activity 2.1.2, I know we talked about that, but I know we mentioned like we can't necessarily address sexual education. So should we reword that? Oh, no. I think we should take it out. Like the sexual education. I think we should like take that, those two, like accessible. I don't know. We could just
research.
I think we should just put in like dating, provide appropriate. Oh, I'm sorry, go ahead.
At Violent Families Stop with Families, starting in August, I started receiving phone calls from family members who, it's parents who, and professionals, who their children with severe intellectual disabilities are going through puberty and they don't know how to handle it. So maybe you can shift the focus from the student individuals to their parents to better educate them, because a lot of these parents have that mindset, oh, he's got the mindset of a 5-year-old, so he shouldn't be doing that, but they're still having those.
Tell us your name.
I'm Jackie.
Like a workshop maybe, is that what you need?
Possibly.
I'm just like throwing
Just
out there, right?
some, I guess, history for if y'all haven't been here. So we did a project or an initiative around that for, it's like 5 years, I think. We did it for 4 or 5 years. And so it was for adults with disabilities and it was caretakers of someone with a disability of any age. Where we did that exact thing. We talked about relationships, we talked about health. And so, I mean, it kind of seems like looking for something, maybe not as focused on the relationship part, maybe more on the sexual part of something that we've done already. The problem I think that we're running into is probably those parents that are going through puberty now weren't concerned about that training when we offered it 5 years ago, but now it's important to them. So doing another round of trainings, I don't think you're not getting your money's worth, because my kid isn't going through puberty right now, I might not go to that training. And then 5 years from now, I'm gonna want you to go back and do that training. So if that is something you wanna do, then you might want to look at, is there a provider out there that can develop some sort of curriculum, not curriculum maybe, but some sort of training that can be recorded, provided, and the resources that we can put online where you can access it later. So it's not an active project. They basically would have the year to come up with these things that we can then go live with. And you're basically paying them for their time and materials they develop, as opposed to a training that goes back and forth. Because we're gonna lose people, and some of the information, if it's generic but still informative enough, we may not have to worry about it changing by the next year. We did a similar concept and way to that with some healthcare modules way back in the day. But I would recommend you look at that as opposed to doing another round of trainings, so we can have that as something that they can just access. But another barrier that we ran into whenever we did this training in the past, there were no providers that put in their SOP that they would do this sort of training for anyone under the age of 18. So there were no teenagers involved, which I think is kind of the focus based on the way this was written, middle school and high school. So providers weren't willing to touch that unless the parents were in the room. And kids aren't going to talk about this stuff when your parent is in the room. So you may also want to consider if they can do something more targeted towards high schoolers that they could have access to, that we would put online, and maybe something for parents that they might have access to. I would go that route instead of another round of trainings.
Oh, yes.
Your idea, going off of what Britton just said, they had puberty parties, like LSU, that's just a slang term for it. LSU Allied Health does them up in our area, where it's just for just kids. They do them for preteens and teens on growing up, your body's changing, and you go and you learn about all the things you're going through, and like a teen tween kind of thing. Could it be done that way? Maybe, doing something in that respect. The hospital system's handling it already, like, if they do it as like a community outreach thing for regular kids anyway.
Right.
Could there be like an adaptive version of it?
I mean, you could, but I think you
Disability population.
fall back into that area of,
They have,
it's an outreach that's only happening as long as we're paying.
ours happens to the LHL. Hopefully where we are,
Right.
in med school. And they bring in the providers they already have on staff to staff that. I'm thinking like, maybe, however they do that as a model, look into it to do it for like, you need their person staff.
Right, I mean, their model is probably they
Yeah.
fund that initiative every year. So if we're looking at doing something like that, each year, we would continue this activity for years and years to make sure it's happening. And I think what my point was, when we did initiatives like this in the past, it wasn't applicable to that family situation, so they missed it, but now they need it.
They do it like in really violent. It's
Right, so every year they're paying for that. What I'm saying is we don't, I think you need to look at an activity where this is going to be something that people can refer to, like have a really nice training or something that's just available online to go to.
That's
instead
gets the
of a-
social skill aspect of it, that we're having with the whole, how do you navigate your school environment as a.
Yeah.
As a suddenly fully included in class level
Mhm.
teenager in middle school, how do I cope with my raging hormones, and how do I address this and that in my school environment, my peers in that respect, because these other peers are getting it, but I'm not.
Yeah. Well, you also
It's not-
run
it's
into
not
the
when you're
problem of
When
if
you're
they
looking
are,
at school.
if they are school age, then we have the minor
Well, but they're,
situation
yeah,
where we
but
have
they're,
to have parents.
but they're already doing it for regular, for atypical.
Right.
And versus typical kids, and it's like, when this thing was the atypical and typical, somehow endear it towards the beauty community. And then pay them. And something.
Yeah, and I mean, I think that's up to the committee. I think yours is an ongoing initiative that can be done, which can certainly be done if that's what the committee wants. And mine is just something that we don't have to continuously fund
Yeah.
the same project over and over. so we can do new things, but it's certainly something that
Social skills
y'all
aspect
can do.
component keeps coming back up. It's the important part. It's one is more geared towards the parents, like they'll be able to go online and access it continuously, and the other would be more targeted actual sort of hands-on.
Sherry, did you have anything?
I was just thinking like this could just be part of our master plan to roll into our website, right? Because we're hoping to build this website of all of these answers, and if we record the trainings, then they're available all the time for everybody, regardless of your kid's age, and you know, and not specific to a certain region, and then you can't get there because of transportation. So I just feel like if we can roll it all up into our website that we're trying to create, it would solve a lot of these problems.
I have a,
Oh,
Hey,
okay,
a committee member that has a comment, and then I also have a public comment.
okay, so Patty, you're recognized, Dr. Barabecchio.
Hey, how is everybody? I just wanted to, I like the way it was, the conversation's going, is that if we used our, you said, the Human Development Center to maybe create some enduring materials, whether it be like, you know, what you need to know about X. And like you said, that it's linked to a dynamic website, right? And that we get our partners like Families Helping Families to post links to these types of materials, or utilize them within their services with families, so that it is there, accessible, and it, you know, just as you mentioned, I don't know who was speaking, but about, you know, transportation difficulties getting to this one-time event in your region, for a in-person lecture. So I think I love the idea of contracting someone with that expertise to develop the materials, whether it be a training or some handouts or, you know, patient discussion cards that physicians could use. I think those types of resources would serve us really well, because then you have Families Helping Families, when they get a call with a family in their region, they can easily, you know, oh, let me send you this, or let's go over this. And so I think that's a great idea, and it would give us more bang for our buck. It would be there for prosperity.
Then you have a public comment from,
Okay,
Adrian Burns.
okay. Okay, recognize.
Hello, hi. Yeah, I think you guys actually kind of covered the way I was thinking. I'm an adult with a disability, and I have two kids with autism, and I just I'm concerned. They're young. They're super young, but I'm concerned about how to explain consent to, because I have a little boy and I have a little girl, so I have both worlds, and I just want to make sure that because like they love to play on each other and they like jump on each other, and they're like, I'm like, you can't do this if they're not if they don't want you on their body. And you know, it's difficult for them to understand at the moment, especially because they're siblings, but I just want to be able to navigate that. If I could put that in as something that would be a great aspect of the materials when you guys get to that would be really helpful, I think.
Thank you, Adrian.
Thank you.
No,
No, I can't. I can remember the contractor, but it was either 23 or 20. Safe Haven, like, they had a really good curriculum for this topic. Was at our YLF session, in what the previous commenter said, like, they had a booklet, and it really like went into like all that and then like blew in plain language, broke it down as to what consent means, what like you can or can not do, and just thinking like maybe like what a 5-year plan, like if there's something in that in our next plan, safe haven would be a good like avenue to look into for like if we needed a training. Don't ask me where they're located.
I was just gonna say, you brought up a great point. I think that based on the conversation of this topic, you could look at a twofold approach if you might do some things next year in your plan, because we have goals that could fall under, obviously, because it's kind of in there. You can also look at accomplishing some of these things through your health areas of emphasis in your 5-year plan if you want more long-range impact. So next year, you might not be changing the world like we're talking about here, but over the next 5 years, you're gonna change lots of things. But just a reminder, you only have 20 minutes left in the meeting.
And you have one more, I'm sorry, you have, oh, they put their hand down.
Okay.
So we're gonna have to kind of wrap up this particular topic. But so far I have preventative screening for women, to be possibly added to 2.3.1 activity. For 2.1.2, information targeted towards high schoolers and or the parents for puberty/sex education awareness. Possibly add that to the website. And also add activity to 2.2, for more training for home and community-based workers.
For activity 2.1.2, I just would like to remove sexual education and provide like healthy relationships instead of sexual education. That way we can, I don't know, we can talk about like consent and things like that. I just feel like giving the.
So what are you trying to do? And are you still looking at that research aspect of that activity, or you actually want to do something with that activity? So right now it just says do
Right.
research.
No, so I guess with activity 2.1.2, I would like to remove conduct research. And I guess just provide some best practices, some recommendations to families. Like, one of our project comments said, so they can talk about consent and things like that.
You have a hand over here too.
Yes, Vivian.
I think it's really important to not get rid of the sex ed aspect of things, especially because most of the disabled population doesn't get that sort of education in school. And like, even if you're not gearing it towards minors, you can gear it towards young adults. And it is a very important concept to learn, not to mention it can help keep lots of people out of prison because they don't understand boundaries in the same way as neurotypicals do, because no one ever taught them, they never found a way to teach them, and they don't know about their bodies, and that's something they really need to learn about, not just boundaries and relationships, because social aspects are hard for neurodivergents, but you also need to teach them about themselves. And just the sex ed part in general is incredibly important, and we can't just completely disregard it.
I think that could be encompassed within the healthy relationships aspect.
They're two very different things. Healthy relationships does not correspond with sex or sexual education.
Thank you.
When you write your plan, you can be specific in your activity of what you want to cover.
Yeah, we can move forward. Should we move on to the 5-year plan, or do we have to? I don't think we have enough time.
You're gonna need to do a motion.
Oh, motion.
You have to motion what you want on your action plan. We're gonna need a second. You gotta go through all that.
Yeah, right. Okay, who's the person in the public?
Melinda Elliott.
Okay, Melinda.
I know we're trying to move on, but I wanted to mention I'm the parent of a 36-year-old. I don't know how that happened, with an intellectual disability. And when I talk to her, I have to be very plain when I talk to her about sex. I'm not sure that the people that we're looking at to help are gonna understand healthy relationships and all the intricacies of sex education just using that term, healthy relationships. I agree with the young lady that was speaking. You probably need to say sex education. That was it.
How should we move forward with the motion?
How do you,
You need one of your committee members to move, to, send these recommendations to the full council.
Correct.
And then the full council will send them to the, planning committee for FY 26.
so I have a technical question about it. Do I have to like, are they gonna list out all of the recommendations for it to accept?
Recommendation.
Yeah. Do you get what I'm saying?
It will be for each recommendation.
No.
We need one for each one?
No. As a whole,
I know, but do I need to list them in the motion?
yes.
That's what I was wondering. Okay.
Okay, you're gonna come up with two recommendations. One is everything you wanna do in next year's plan, and two is everything you wanna have for concepts for your 5-year plan.
Okay, so do I need to move by you seconding, oh, you're gonna share your screen.
Yes. Make it bigger.
Oh, but first I have to ask, would anyone like to make a motion?
Yes.
Would anyone like to make a motion with these recommendations? Which will be on the screen.
Preventative screening for women.
I kind of wrote some. I'm sorry, I was trying to take notes and answer questions. And I didn't know which one were 5 years, I was just trying to listen and take notes.
Preventative screening
Okay, preventative screening.
for women.
So do we need to include the objective and how we're wanting it revised? Thank you.
Just an overall idea of what the activity would be.
Then the next one, you ready? Okay, the next one is, well, I guess we're gonna keep the sex education and not change it to healthy relationships, right?
Sorry, what was
We're
that?
not changing sex education to healthy
Or
relationships.
put and or.
Okay.
Oh, it could be.
So the activity is to have information targeted towards high schoolers and or parents for puberty, class sex education,
It was like
awareness.
sexual development. Yeah. I don't know, I just feel I feel like it's a very touchy topic.
How about I'll do that?
Something,
Writing it.
sorry, we have hands. Eric,
I truly think this is a very touchy situation that we're messing with. And I think that we just need to be very careful how we dealing with this. I mean, truthfully,
Well, that's gonna be the trainer or whoever developing material, they're the ones that are gonna figure out a way to present this information that is comfortable for those that are seeking this information
In a professional manner.
in a professional manner. We're just saying that's something as a council, we may want to look at, and then the burden is gonna be on those that we contract with to really put this information in a package, however we decide to implement that package. That's really gonna keep everyone comfortable.
but this is something we looking at the fund.
Oh, possibly. This is strictly just an idea, like if the council approves, then the planning committee is gonna look at these ideas and decide what they think should be a priority. What it might cost to do these things, how much money they might wanna assign to these different things. And then it's gonna come back to y'all as a full council as a recommendation at the next meeting, right? I think the next meeting in April.
We only have 10 minutes, so I just wanna say this because it may wrap up the discussion. These are only recommendations.
Right.
Where these conversations should be had is the planning committee for the next action plan, which will be before the April meeting. So you guys can discuss and debate whether or not you wanna include puberty, sex education, sexual development in that particular meeting. These are just recommendations to send to the planning.
Okay, and we can discuss more tomorrow.
All right, not even tomorrow, at the planning.
And the planning,
Right.
Just overall ideas,
Yes.
not how you're gonna implement.
Yes.
Okay.
We don't even have to get in the weeds. These are just,
right,
you'll get into the weeds at that planning committee.
all right.
Can
Okay,
I get a
given that we have.
point of clarity though, for
Yes.
parliamentary reasons, I see it being typed, has there actually been a motion made, did anyone? Okay.
No.
Okay. Because otherwise you wouldn't be able to do the conversation, okay.
Okay, given that we have 10 minutes, Vivian, can you please keep it to less than a minute so we can.
Okay, you don't wanna use the word sexual development, rather than you wanna stick with sex ed because it covers not just development, but it covers the broader areas such as consent, how to behave in public versus private, what's acceptable, what's not, where and how to do things versus, and you can gear it towards young adults instead of minors to avoid any sticky situations. But this is something completely natural and it needs to be discussed. The fact that there is hesitance in this room to discuss such a thing is why we need to push this.
Okay, thank you.
So I would like me to change. To what? The committee.
Yeah,
And it doesn't have to be done now, it can also be done when you have the planning meeting, how the wording is gonna be, this is just more of an idea, so we know.
Okay.
Yes.
I think it just really, like Brooke was saying, instead of conduct research, I think that it is, we need to like promote it or change the word from conducting research to actually implementing,
So-
resources or whatever, and then go into it further in the planning.
Okay, so would anyone on the committee like to make a motion with these recommendations?
Was it just these two?
No, we also had one to add, training for home and community-based workers. So we can receive clarity on it.
Was that gonna be under activity 2.1.1, training for the DSW? Okay. And that was the last.
That was the last one.
Okay, so now would anyone like to make a motion with these recommendations?
Oh, I'll make a motion for all this.
Is there a second?
Do I need reading?
Oh, Jill makes a motion to. Yes.
Recommend recommend the following concept for, is it 26 or 27?
26.
Okay. Is there a second?
Second.
Thank you. Julie, second. For the information targets to high school, we're gonna strike out. Okay. Is that okay?
Yes.
Okay. Okay, so is there any discussion? Yes, Vivian.
Hi, once again, I'm here to talk about the word choice. You do not want to use sexual development and want to stick to sex education solely because saying sexual development helps, like, narrows it down far too much, whereas sex education is broader and covers a lot more content that everyone needs to know. And populations such as ours do not get this type of education as often as the neurotypical population. So we really don't want to narrow this down, like, too narrow, because we need to encompass enough information to where we get enough knowledge to exist in our community without being scrutinized, imprisoned, hospitalized even. We don't want to be marked as the creepy or like pedophiles or anything like that, because not everyone knows how to behave in certain situations, and then they don't understand the same concepts as neurotypicals because no one ever taught them. You do not want to stick strictly to relationships or sexual
Okay,
development.
thank you, Vivian. You didn't hit the minute, so thank you. Okay, is there any public comment?
Yes, but saying sexual development narrows it down.
Okay. Now we will do a roll call vote. Rakisha, can you please call roll call?
Dr. Baravecchio,
Yes.
Dr. Baravecchio, yes. Mr. Bennett,
Yes.
Mr. Bennett, yes. Mr. Billings, Ms. Crane,
Yes.
Ms. Crane, yes. Ms. Hagan,
Yes.
Ms. Hagan, yes. Ms. Hayno. Ms. Hayno, yes. Ms. Harmon. Ms. Kelly Aduli.
Yes.
Ms. Kelly Aduli, yes. Ms. Nguyen. Mr. Rocker.
Yes.
Mr. Rocker, yes. We have 7 yeses.
Okay, thank you. The motion to recommend the following activities for fiscal year 2026, seconded by Julie Foster Hagan, has passed by a vote of 7-0. Okay, and how are we moving forward?
You can't do any updates or anything. Everything's been put in your packet, so you can review. Ms. Julie actually will be giving an update on tomorrow as well.
Yeah, I'll have the things we talked about when I talked.
Transportation or concept.
Yeah, y'all didn't
This
do your
presentation,
5-year.
I need a motion for it.
Okay,
Yeah, you didn't do the 5-year plan stuff. Y'all have to do that.
yeah.
I can improve.
And I know you guys talked about transportation earlier. That's something you would
Oh,
like
for the-
to add to your concepts.
Okay,
Gotta be quick though.
okay.
Education starts in 4 minutes.
So education starts in 4 minutes. These are the concepts, right, that we have.
Those are the options.
Okay. So we talked, I believe Tony Piontek had brought up transportation. And then Jill and I did mention the FMLA style parents or style leave for parents of individuals with developmental disabilities to help sustain employment. We talked about requiring Medicaid to cover both standard and electric wheelchairs, healthcare coverage for DSPs or DSWs, and then task force training on abuse and neglect.
I'm missing one, I'm sorry, what was the last one?
Abuse and neglect training.
Recovery.
The healthcare coverage for DSWs.
Thank you, sorry, I knew I was missing one.
Okay, so would anyone like to make a motion with these recommendations?
Sure.
Thank you. Jill, recommend, motions to recommend. Yeah. Motions to recommend the following ideas and concepts. Hello? Is there a second?
I can't, you got Medicaid stuff up there.
Can our ex officio? Session second?
No.
Oh,
Who's the- Yes. Right. Because he's medic.
yeah, it wouldn't look so great if any of us from LDH.
I'm on Sheree.
asked. All right, I'll.
Thank you. Seconded by Sherry.
Sherry.
Is there any discussion? Is there any public comment? Okay, we will now do a roll call vote. Rakisha, please call the roll.
Dr. Maravecchio,
Oops, sorry. Yes.
Dr. Maravecchio, yes. Mr. Bennett,
Abstain.
abstain. Mr. Bennett abstain. Mr. Billings? Ms. Crane?
Yes.
Ms. Crane, yes. Ms. Hagan?
Thing.
Ms. Hagan abstain. Ms. Hayno?
Yeah.
Ms. Hayno, yes. Ms. Harmon? Ms. Kelly Dooley?
Yes.
Kelly Dooley, yes. Ms. Nguyen? Mr. Rocca?
Yes.
Mr. Rocca, yes. You have 5 yeas, 2 abstentions.
Okay, thank you. The motion to adopt the, or sorry, to recommend, what's at the top?
Oh my gosh, I'm sorry.
Sorry, thank you. The motion to recommend the following ideas and concepts for the 2027-2031 5-year plan below has passed by a vote of 5 with 2 abstentions. Okay. All right. let me skip over that. All right, so please note after this meeting, Education Employment Committee will be meeting in this room until 3:45, followed by the Act 378 Subcommittee. Tomorrow is the full council meeting, which starts at 8:30 a.m. It will be in the same room. Those that have registered to participate virtually should have the links to that meeting in their email. Okay, and I hereby adjourn the meeting at 2:15.
I'm a moment.